Hey guys, this is Dr. Leah Hahn with Body and Balance, and today I wanted to give you a better explanation of why so many people deal with neck pain. And I love this poster that's in our office because it really helps patients figure out where they're at on a whole spectrum of what could be happening with their spine or what could be causing their pain. And what I will tell you is that we look at a whole range of what the spine can go through. Now, a normal situation, if we have a normal neck, what we should see is a forward curve. We should see nice spacing between the vertebrae, and we should see nice smooth edges to the bone. That's one scenario. I would say over 50% of our patients actually come in with phase 1 of degeneration going on within their spine, especially in the neck. Now, what that looks like is their head has moved out in front of the rest of their body. That is straining and pulling the spinal cord that exists within that structure. But what you see in phase 1 is that the bones still have not really been affected too much. We're not in an arthritic state in this kind of a situation. The spacing is still normal between the bones. Now, this is typically when patients are starting to really experience a lot of neck pain because the muscles that have to work to support the head, which weighs about 10 to 12 pounds, are working overtime, especially if that patient is having to do a lot of manual labor and having to bend forward, or if they're sitting at a computer using a lot of technology throughout the day. And then we start to see phase 2 and phase 3, which we have many patients that come in this situation as well. What you see with phase 2 and phase 3 is that phase 1, this without having a curve, has lasted in their body, has been there for 15, 20 years, and they've started to develop arthritic changes to the spine. So what you see in that scenario is a decreased space for the disc. Usually the nerve has more degeneration within it. We've got a lot of long-term problems that have developed in that scenario. But depending on what we find in the testing that we do, it really gives us a fairly accurate way to figure out what is it going to take to help this person heal. How are we going to make changes and correction within their spine so they don't move into phase 4, which is really when the spine is trying to fuse itself together. There's so much that can be done, but the first piece is really figuring out where you're at in that spectrum. I hope that information is helpful, and I'll see you next time.